Counsel.
Morning.
Good morning.
So, Dr. Saathoff, as I understand it, you conducted your investigation or examination of Lindsay by Zoom, correct?
Did you say by June?
Sorry, Zoom. You know,
By Zoom, okay.
Television.
I thought you said because it was the 4th of June. Yes, sir.
Okay. And can you tell us when you were first engaged by the district attorney's office to assist them in this case?
I first was informed about the case, I think, in January or early February of 2026 of this year. The final contract with the university was not completed, as I recall, until April.
And is that a matter of significant import when you're engaged in evaluating a young woman that's charged with triple homicide and you're hired by the government? The fact that there's a contract that wasn't signed by your school?
Well, sometimes it's a long process that I don't have any control over.
Sure, I understand.
I've seen those kinds of things take a while, take longer than one would necessarily want.
So the contract with your school that you're talking about would be the contract for your compensation, for your opinion?
Well, I would never be contracted for an opinion.
Okay.
But
you're getting paid, right?
No, I'm getting paid a salary.
Yes.
The university is getting paid.
And the university is deriving a benefit monetarily from your testimony or working on this case for the DA, right?
That's right.
All right. And how much did the university get as a result of your involvement in this case?
I don't know what the hourly rate is that they charge.
So you don't know what the hourly rate for your time is, right?
Correct.
You don't know how much money was paid by the district attorney's office to the university, right?
Correct.
You don't know how much money will be paid for perhaps yesterday, today, whatever, balance billing. You don't know that either, right?
That's right.
You were retained or engaged in January of 26, right?
Yes.
This is an incident that occurred on January of 23, right?
Yes.
In January of 23 to January of 26, 3 years.
That's right.
To being engaged on the case, right?
Correct.
And when you were engaged on the case, at some point the university must have been out of the picture and you must have started to communicate with the DA's office, the police, or whoever.
That's right.
And you knew about this case. It had a significant amount of publicity, right?
Yes.
Did you know that other doctors on behalf of the district attorney's office were being hired to also evaluate Lindsay?
I didn't specifically know that, but that's usually the case.
Is it important to see someone, to evaluate them as close in time as the incident is alleged to have occurred to your evaluation, or does it matter? In other words, is it better to see someone like, within a month or two after an incident, or 3.5 years later?
Well, what's most important is the collateral information that was gathered at the time to understand what was going on at the time. Ms. Clancy's behavior during her hospitalization and the like, there are records, but certainly there are benefits to an examination closer to the event.
And you would agree with me, sir, that you actually saw and questioned or interrogated Lindsay, 2 months ago?
May 29th and June 4th.
Okay. And when you went to interview her in purposes of your evaluation, you would already access the collateral information, sir?
Yes.
Before I go there, let me just review a few things here on your CV, which the jurors will have to examine. You indicated to us your present employment. You have a private practice as a psychiatrist?
No.
Okay. So where do you see patients?
Well, I see patients in the prison system.
They're your patients?
Yes.
What do you do for those people that are in jail?
In prison, within the Virginia Department of Corrections, we have inmates within the prison system who suffer from mental illness and require assessment and treatment.
I see. So you don't have, when you said to the jury a little while ago, if I'm treating my patient and I would prescribe a particular prescription for my patient and I wouldn't tell my patient to do whatever it is you said, it's not people that go to an office or see you or even on the television to be treated. These are people that are in jail, right?
Prison, yes.
So there's a difference between jail and prison, right?
Yes.
And this would be in Virginia, is it?
Correct.
So you're dealing with people that are serving hard time in the Iron Mansion, as they say. It's not a house of correction down the street, right?
I see patients who have different varying sentences. Some have life sentences. Some are scheduled for release, in the coming month. So that really varies.
And you work on behalf of the state to evaluate prisoners to determine whether or not they are fit, if you will, to be released into society, right?
Once someone's sentence is over, the only way that they could be continued within a prison system would be to be committed to a psychiatric hospital. And I would say that in the 34 years that I've been treating inmates who are patients, I can only recall 2 times where when discharge came up, their condition was such that they required to be civilly committed because of mental illness.
And when you are talking as a forensic psychiatrist evaluator, would that be on behalf of the BOP, Bureau of Prisons?
I have consulted with the Bureau of Prisons on just a few occasions, but
Okay.
Bureau of Prisons is federal, and
Yeah, I know that.
most of my work has been with state.
Okay, but on your resume, sir, you indicate from 2019 through the present, that's a number of years, that you have been employed or engaged as a forensic psychiatrist evaluator on behalf of the United States Bureau of Prisons as it relates to probation or parole. Is that in your resume?
Yes.
And that means, sir, that you evaluate inmates that are trying to get out of jail, and you would evaluate them to determine if they're appropriate for parole, right?
No.
Okay. So when you indicate on your resume from 2019 through the present, you're employed as a forensic psychiatrist evaluator for the United States Bureau of Prisons. How many of these evaluations did you do in the years from 2019 through 2026? 7 years.
I think I've done 2 or 3.
2 or 3.
Yes.
Okay. 2016 through 2022, you're engaged as a consultant psychiatrist for the Elson Student Health Center. What is that?
That's the Student Health Center at the University of Virginia. So that serves students who are at the university.
And like what? I mean, do you evaluate them? Do you treat them? Do you analyze them? What do you do for college students?
My work with the university and the health center really had to do with students who were having difficulty and had left the university and were interested in getting back. And so I was part of a three-person panel to evaluate the students to see whether or not it would be appropriate to bring them back to the university.
And what, were they like thrown out of the university, or they were disciplined or something? Why would you bring them back? What does that mean?
Well, if there was an event that caused concern, potentially was a threat, for example, then just for the student safety and the safety of all, they would leave the university in order to get the type of care that they needed. And then if they want to come back, then I was part of a panel that would evaluate these students and make a determination about whether it was safe.
So these are the students. I'm sorry, I cut you off. Go ahead.
Yeah. No, that's all right.
Okay. These are students, right?
Correct.
In college, right?
That's right.
That have been thrown out or disciplined or suspended or something, and they're trying to get back into school, right?
That's right.
And when the parents of the students come, they retain you to advocate on their behalf?
No.
No, you work for the school, right?
Correct.
You evaluate them and then back the school up so that these kids can't get back into the school, right?
Can you ask that question again?
No, that's all right. 1999 through the present, you work for the United States Department of Justice, and the United States Department of State, right?
Yes.
Okay. And that would be the United States Attorney's Office, the prosecutors. Like, they're the state prosecutors, you get federal prosecutors, right?
Well, federal prosecutors and defenders. I've worked with both.
Well, the defenders certainly don't work for the United States Department of Justice or the United States Department of State, do they?
I was under the impression that federal public defenders were under the umbrella of the Department of Justice.
No, that's called the CJAC. That would be a totally different group of people. Those are people that defend people to try to have them not be abused by the system, if you will.
Yeah, that question be stricken.
2015, you're a psychiatric consultant for the Virginia Office of the Attorney General. Another prosecuting arm, right?
Yes.
2013, Virginia Department of the Virginia Department of Corrections, least restrictive measures for segregation. You evaluate people to determine if they should be in max or disciplinary unit as opposed to general population. Is that what you do?
Yes, I've been asked to do that.
Okay. And you certainly don't advocate on behalf of the prisoners that are being placed in seg or being placed in those closed units with higher security, right?
No, that's not true at all.
The National Security Expert 2007 to the present, Oak Ridge United Associated Universities. What is that?
Yes, that is a group that does research with the Behavioral Analysis Unit and the National Center for Analysis of Violent Crime, and I have done work with them.
Okay. Critical Incident Analysis Group, CIAG, University of Virginia.
Yes.
Okay. Behavioral Analysis Unit, as you told us yesterday, for the FBI at Quantico, right?
That's right.
Psychiatric consultant to the Virginia Department of Corrections, medium, maximum, and supermax facilities, right?
Yes.
Continuing on with your experience, sir, as a witness in this case, you'd agree with me that you were involved as a psychiatric consultant with the Macro Task Force on-site consultation for the Australian Police Service.
Yes.
Former Soviet Union project, Republic of Georgia, TBILISI, Georgia. You were involved with that, sir?
Tbilisi.
Tbilisi, yeah. Critical Incident Response Group for the U.S. Air Force. You're in the assessment unit.
Yes.
Crisis Management Unit, investigative support for Operation Gray Sunset, Jordan.
Correct.
Crisis Management Unit, investigative support unit, critical incident response in Montreal, Quebec.
Yes.
FBI, National Center for Analysis of Violent Crime, Operation New Hope.
Yes.
Bureau of Criminal Investigation, that's BCI, for the Department of the State Police. Would that be Virginia?
Yes.
You also have an interest in and have studied or written about various topics in your career, correct?
Yes.
Okay. Hostage negotiations course, crisis management unit. You were involved with that, is that correct?
Correct.
That was a number of years ago, though. I guess that was like 1996.
That's right.
But you've been involved with the FBI for a long time, right?
Yes.
Fair to say that you're a government man?
Objection.
No, sustained.
Hostage negotiation course. How about Virginia Department of State Police? You involved with them as well, sir? Yes?
Yes.
Advisory positions. You deal with Islam in prison is one of your interests, right? That was a TV program or something?
Correct.
You talk about National Institute for Justice, Standing Committee to advise the Department of State on unexplained health effects on U.S. government employees and their families overseas, right?
Yes.
Analysis of pre-attack behaviors of the Las Vegas shooter behavioral analysis unit for the FBI.
Yes.
Skipping ahead, papers published. Now, when a doctor or a psychiatrist, or even any doctor really, I guess, publishes a paper that's of interest to other doctors or people, that's called a learned treatise, right? Peer review?
Yes.
Okay. Can you tell me, what is peer review? What does that mean when you're dealing with a person's focus and interest in writing about what they're focused on?
So a peer review journal is one in which once an article is submitted, a paper for publication, that goes to qualified people within the same field who review it and make determinations about the quality and whether or not it should be published. Oftentimes, there will be some edits or suggested edits from those who have expertise. It's a blind process, so if I submit a paper and it's peer reviewed, I don't know necessarily at all who is reviewing it, but it's a way to ensure quality of articles that are published, and that's just an important standard.
So it's kind of a rigorous standard to make sure that what you're writing about is reliable and would be helpful to others that are interested in it, right?
Correct.
Okay. So, for example, also it depends on where you're publishing it. You can put something in the National Enquirer, or you could put it in International Psychiatric something or other, right? Which would be a better publication.
I don't think the Enquirer is peer reviewed, but.
So you certainly would agree with me that the International Journal of Law and Psychiatry is a respected source for learned treatises, right?
Yes.
And you would agree with me, sir, that you've been in here telling this jury all about Lindsay and how she didn't hear voices or did hear voices or exaggerated and lied. Have you written any articles at all on the concept of auditory hallucinations?
No.
Have you read any of them?
Read any articles? Yes.
Yeah, okay. You certainly have heard of Dr. Philip Resnick, yes?
Yes.
And it's fair to say, tell me if I'm wrong, is he literally a world-known authority in your field for filicide or the killing of children by their parents?
Yes, he's well known.
And is he also well-written as far as auditory hallucinations, same stuff you've been testifying about?
Yes.
And he published an article in the International Journal of Law and Psychiatry, which is considered to be, if you know, a landmark article about, and I captioned, listening to voices, the use of phenomenology to differentiate malingered from genuine auditory verbal hallucinations. Now, did you read that article?
Yes.
So it is a peer-reviewed article published in a recognized journal, correct?
Correct.
Your Honor, I would offer this under Commonwealth versus Sneed for the jury, if they wish.
Objection.
Counsel Garcia at sidebar.
Your Honor, while that copy is being made for the district attorney, could I continue?
Sure.
Thank you. Leaving aside peer review article and the article written by Dr. Philip Resnick, sir, for a minute, papers that you published, and you have in your resume, it says peer reviewed, so that's just what we were talking about, right?
That's right.
All right. Using the moral situational action model of extremist violence to assess fluctuating levels of risk in women, the relevance of risk promotive and protective factors. What does that mean, levels of risk in women with extremist violence?
We're looking at risk assessment in terms of violence and what may be mitigating factors. In other words, decreasing the risk or the threat, or increasing, that would be enhancing factors. But this is looking at a group in terms of research.
And it's research about women that are involved with extremist violence?
Yes.
Okay. Assessing, strike that. Using the moral situational action violence risk model for assessing women involved in extremist violence, an empirical study. Is that a similar article?
Yes.
Operationalizing theory, a moral situational action model for extremist violence. That would include guys plus women, I guess, right?
I'm sorry.
That would include men plus women, I guess, right? Because it doesn't
Yes.
say women. Suicide, terrorism, performance, violence as a public plunge. You wrote that, right?
Correct.
It's another interest. Crisis leadership and military community resilience. You wrote that, right?
Correct.
Painting by numbers, capturing the pathology of socio-political conflict, dealing with depression amongst Palestinians. You wrote that, right?
Correct.
Psychological challenges of bioterror. You wrote that, right?
Correct.
Trauma and intergenerations transmissions in Kuwait. You wrote that, right?
Yes.
Recognizing borderline personality disorder in the family practice setting. You wrote that, right?
That's right.
Mortality among elderly patients discharged from a state hospital. It's one of your interests, right?
That's right.
Postpartum psychosis induced by bromocriptine. That's the one that you told the jury about originally that you published 40 years ago, right?
Yes.
Okay. Morality and the radicalization of women. What is that? What was that all about?
Could I be refreshed with that? I'm
Sure. It's just, I mean, you can look at your resume if you wish. I'm just going through it. It's under B, books and chapters. This one is the first one, and it deals with radicalization of women. A handbook, I guess, for terrorism studies. You remember that? It's only 4 years ago.
Yes.
Okay. Application of big data for national security, a practitioner's guide. You wrote that, right?
Correct. I was one of 4 editors.
Crisis Guide of Psychoactive Drugs and Poisons for the Crisis Negotiation Unit. You wrote that, right?
That's right.
International Handbook of Threat Assessment, right? Yes. Protection of Children During Armed Political Conflicts, a Multidisciplinary Perspective, right?
Yes.
The Negotiator's Guide, like when somebody's locked in a building and they're threatening to kill people or something, the Negotiator's Guide to Psychoactive Drugs, 2nd edition. You wrote a chapter on that, right?
That's right.
The Negotiator's Guide. And it goes on and on with the negotiators and things like that. Terrorism negotiators, right? It's fair to say that's your focus?
Correct. Well,
Well, I know you can talk about postpartum, but I mean, I'm asking you if your resume that you prepared, I imagine, well before you were hired by this DA's office, sets forth your interest, right?
yes.
Okay.
The characterization of negotiation as trying to stop killers is not accurate.
I'm probably wrong.
Comprehensive.
I apologize. You see it on TV, the negotiators, and they're trying to help people that are being kidnapped
on a bridge,
on
in
a bridge,
crisis,
yeah.
something like that. So,
just a few more, Doctor. Panels and symposia. You'd agree with, let's see, national security I just want to run through a quick attachment theory, mental wellness as it relates to threat management, threat assessments, corrections, psychiatry presentations, substance abuse and misuse in prisons, perspective on providing medical support during conflict and chaos, targeted violence in the media, lessons from history, the profiler of poisons, understanding the female extremist, crisis operations, leadership, how to fool doctors by injecting chemicals into muscle to obtain opioids, a prison inmate comes clean. Did I read all those topics correctly, sir?
correct.
Invited lectures, talk about extremism, terrorism, the future of policing, children in long-term abductions, how to prevent terrorism, mass shooters, U.S. prisoners, religious rights, religious radicalization, terrorism and the unknown enemy. Basically, that's what your focus is, sir, correct?
No.
And that's coupled with your experience of the two people or so that you recall dealing with in your, it's not a practice, but working for the Bureau of Prisons or the state for Virginia, the people that are in jail, that is the sum total, to be respected, of Dr. Saathoff, correct? I mean, you treated two people. You've written a lot about terrorism and other issues that we went through.
That's not at all a correct characterization.
Oh, I'm sorry, because I read your resume, right?
Yes.
Okay, and I related what you indicated to the jury, your experience when I asked you about patients or treating people. I said that right?
I've been treating patients, and I continue to for the last 40 years.
Now, in all of your experience, sir, have you ever treated a woman suffering from postpartum psychosis?
Yes.
When?
In the late 1980s and also during the 1990s when I ran a unit in a state hospital.
So this would be women, 1980s, about 30 years ago or 20 years ago, depending on which one, in a prison that you were...
No.
Oh, it wasn't.
In a state hospital.
State hospital. Were they
Correct.
committed? Were they there because they wanted to be there, or were they committed by order of the court?
Yes.
Yes, what?
Usually committed.
Okay. So other than that, sir, do you have any interest, writing, knowledge about postpartum depression, postpartum psychosis?
Well, it really is a requirement when you assess and treat women to be aware of their histories and making determinations. So that has continued really throughout my career, men and women.
What did you just say? Can you repeat that again? You're treating women with what?
Treating women with psychiatric problems, serious illness, psychosis.
So when you defined for the district attorney the concept of, let's say, psychosis yesterday, were you referring in any degree to a woman who has had a baby and is in a period of postpartum depression, shall we say?
Yes.
Okay. And when and how were you treating those people?
That was during the period of 15 years when I ran a unit of men and women who came in with serious psychiatric symptoms.
So what would you do? Would you analyze them? Would you talk to them, counsel them? What would you do while they're in the hospital?
Well, do a full assessment with a multidisciplinary team and make determinations about proper treatment, proper therapy, medications and the like to treat the symptoms.
And generally, what would the symptoms be, sir, in your experience?
Symptoms of postpartum depression?
Yeah.
Okay. Well, certainly within that period of time around birth or after birth, the DSM has a 4-week period. Others expand that to as much as a year. But certainly depressive symptoms postpartum are similar to the symptoms that you see in a regular depression. You can have suicidality, you can have guilt, changes in appetite, changes in weight, changes in concentration, changes in physical activity. You can also have significant problems with sleep. either sleeping too much or not enough. So these are depressive symptoms that come in the postpartum period and require assessment and treatment.
Are you aware, sir, in your practice or studies of the number of women that commit suicide during the postpartum period? Are you aware of that?
I can't quote you a figure.
Do you have any clue at all?
No.
Would you agree with me, sir, that one of the unfortunate components of a woman who has had a baby and is suffering from postpartum depression and living with it, that can, on a dime, turn into postpartum psychosis very quick, right?
It can be rapid.
And you indicated, sir, that there, according to the DSM, is a 4-week cutoff for symptomology, and then you mentioned that there are others. Is it the World Health Organization that you said that talks about a year?
Correct.
There are some other psychiatric organizations that talk about different periods of time, 6 weeks, 8 weeks, right?
Correct.
So when a woman is dealing with these symptoms and goes to a doctor, or even you, when you're treating, as you indicated 15, 20 years ago, you were treating, is it important to take a blood test?
I'm sorry, can you repeat that?
I'm sorry, my bad. Is it important to take a blood test?
Is it important to take a blood test?
Yeah, you just went through the whole thing about we're going to have the team and they're going to evaluate and we're going to prescribe. I'm just asking, is it important to take a blood test of the patient?
It can be.
Based on what?
Based on the presenting symptoms, based on the history, based on medical history. For example, if someone has recently been in a hospital and been treated, there may not be a necessity for drawing blood again, depending on the types of symptoms that you encounter. It's not a standard that everyone who presents to a psychiatrist requires blood tests.
So if you're a psychiatrist who's been practicing private practice for about, I don't know, a month, maybe 2, and is prescribing antipsychotic medications, selective serotonin reuptake inhibitor medications, benzodiazepine medications to a young woman who is complaining of what the young woman perceives to be difficulties postpartum, is it important to take a blood test to find out what, if any, prescription drugs they have on board in their system?
To check and find out, did you say what drugs are on board?
Yeah, I mean, you're treating this patient, right? And they're coming off the, hypothetically with you, but they're coming off the street to see a psychiatrist for help, right?
Yes.
And if they're already been prescribed drug after drug after drug by a particular doctor with her 2 months of robust experience, is it a fair statement that you should take a blood test of that person?
Well, it really depends on the medication. There are some medications that really require blood tests because of levels and the like. Many psychotropic medications are not easily, there's not an easy test for the amount of medication in the system. So it depends on the circumstances, and it depends on the medication. I mean, for example, lithium or carbamazepine or valproic acid, those are all mood stabilizers. Certainly taking a blood test would be very important. So it depends.
Depends. Can I just ask you to spell those 2 drugs that you just pronounced for the stenographer, please?
Carbamazepine.
Yeah.
Carbamazepine.
Okay.
Valproic acid, VALPROIC acid, also known as valproate, VALPROATE. wbz-TE. And did I mention lithium?
That's not a hard one. The record has to be accurate, that's all.
Understood.
Okay. Now, doctor, are there other tests in your experience that are or can be or should be administered to a young woman or a woman who's had a baby and is coming to a doctor, like Dr. Tufts, for example? Are there other tests that can be administered to determine if, in fact, that person is suffering from postpartum depression?
I'm not aware of any specific test that specifically diagnoses depression. Years and years ago.
Oh, postpartum depression, sir.
Pardon me?
Postpartum depression is my question.
Correct.
Depression. I know you want to say it's the same thing, but postpartum depression is my question.
And you're asking if there's a blood test for postpartum depression?
I'm asking if there's any tests at all that a psychiatrist can or should administer to the patient coming to them for help.
Well, there's the Edinburgh scale, which is a self-report that patients fill out for who are postpartum.
You looked that up last night?
No.
Well, you knew about the Edinburgh scale?
Yes.
You administer the Edinburgh scale?
Pardon me?
Have you administered the Edinburgh scale?
No. It's a self-report, usually given by nurses.
Nurses, okay. In any event, it's a scale that is a useful tool to determine the level or degree of depression that a person may be expressing that is suffering from postpartum depression, correct?
That's right.
And do you know what the numbers are on the scale? Like, is it 1 to 23 or is it 1 to 50, or do you know what it is?
It's a 30-point scale.
When you say
So 1 to 30, as I understand it.
And when you say a self-report, the patient would then advise what symptomology they're suffering at that particular point in time, right?
Correct.
And then the doctor would then determine whether or not there is a risk or an extreme risk or a deadly risk of this person committing suicide, harming someone else, whether it's a baby or anybody else, and determine what the level of their postpartum depression is, right?
Yes, it can help.
And did Dr. Tufts administer Edinburgh test to this young woman?
I know that, Ms. Clancy, there were a number of Edinburgh tests that were given to her, so that there are some scores in her record. I can't recall which practitioner gave her the Edinburgh test, but I do recall that there are a number of scores within her medical record.
Right. And what was her highest score?
The highest score that I recall was 23.
23 out of 30, right?
Correct.
And over 15, the patient is in pretty serious trouble, right?
Over 15 is concerning, definitely.
Right. And she was 23. Right?
Yes, I believe so. I think they ranged from 19 to 23, just
Right,
from my
they
memory.
increase as time went by, right? She was getting worse,
Correct.
right? Yeah. All right. And in addition to the regular blood test, which costs like, I don't know, about $100 to administer a blood test to see what somebody's got in their system. It's not a lot of money, right, for the insurance company.
I just didn't hear you.
Blood test. It's not a lot of money for an insurance company to pay, right, to cover.
Correct.
Okay. So do you feel that it is reasonable medical procedure for a psychiatrist dealing with a woman who is expressing under the Edinburgh scale off the charts or serious trouble, who is on medication, as we went through, the antipsychotic drugs, the SSRI drugs, the amitriptylines at the end of the period of treatment with these people, the benzodiazepines, it's helpful to take a blood test, right?
It can be.
And is that, in your opinion, sir, to a reasonable degree of medical certainty, a step that should be taken by a competent doctor?
That taking blood tests can be appropriate, yes.
And then there's an additional blood test that you can use when you're dealing with a woman who's suffering from postpartum depression or coming to the doctor for help, and they have significant narcotics or prescription drugs in their system, and that would be an enzyme test, right?
I'm not aware of an enzyme test being typically available or used.
Well, it costs a lot of money, doesn't it? Like, it costs a couple of grand?
I don't know.
All right. In any event, sir, are there any other concerns that one would have if they're competent and they're treating somebody that's come to them for help, in addition to a blood test and perhaps enzyme test to determine the metabolizing aspect of the person's system, metabolizing or processing these drugs that are in their system, the enzyme test? Are there any other tests or concerns that you have with a woman whose postpartum depression complaints come to your doorstep?
Well, depending on the presentation, sometimes it's helpful to check thyroid function. That can certainly be a cause of psychiatric symptoms.
Did they do a thyroid test on Lindsay?
No.
That's not a lot of money that the insurance company would complain about, right?
Correct.
One of the things that I just don't want to forget, sir, is that the district attorney asked you, while we're talking about the drugs, about the Lamictal, otherwise known as lamotrigine. Did I pronounce that right?
Lamotrigine, yes.
Lamotrigine. And she said that Lamictal, it has a side effect of a rash, right? You recall that, sir?
I think I said serious rash.
No, I think she said rash. You may, it's up to the jury what their recollection is, but you may have said serious rash, but we both agree. It's a serious rash, right?
Yes.
In fact, it can be fatal, right?
In very rare occasions, yes.
It can be fatal, right?
Yes, in very rare occasions.
Well, if one person out of 1,000 gets Stevens-Johnson syndrome or prurigo nodularis as a result of taking that medication, that's something that we should not tolerate as doctors, right?
Risks and benefits are something that every physician, every prescriber needs to think about.
So you've heard of, as it relates to Lamictal as a prescription drug, what's called 10. You've heard of that, right? As a side effect?
Yes.
And that means what?
It is a pretty severe reaction of the skin, as I recall, causing blistering. I mean, it's very significant.
So if you have a young woman who is a nurse, an RN, who worked for 7 years in a very prestigious hospital's labor and delivery unit, who was so nervous about drugs that were being prescribed to her that she would at night sit in her kitchen on her phone and Google all sorts of side effects of narcotics, the drugs, the Seroquel, lamotrigine, all of these drugs. Is it an unreasonable decision for her to say, I don't want to take that drug, in your opinion?
It seems like you're asking, is it reasonable to decide not to take the drug?
Yeah, that's what she did. That's what you told us yesterday. That's what the DA asked you yesterday, right?
It was a decision that she made.
And in your opinion, sir, after we just went through all of this with the TENS, with the toxic epidural necrolysis and all the rest of that, and she's a nurse, and she's looking up these drugs that she's being prescribed and says, I don't wish to take that drug, in your opinion, to a reasonable degree of psychiatric certainty based on your experience, is that a reasonable decision for her to say, I don't want to take it?
The benefits of that drug are profound, and millions of Americans take that medication and find it to be very important for them.
Doctor, you're an intelligent man, you're a doctor, you've got a lot of experience dealing with the prison system, we've already gone over all of that. You understand my question, don't you?
Yes.
Is that a reasonable decision for Lindsay to make to say, I don't wish to take that drug? Based on all the side effects, whether or not it's rare that people die, whether or not it's rare that they break out on their skin with these permanent lesions and bleeding pustules, is it reasonable for her to say, I don't want to take it?
In her mind, it was.
Yeah. And certainly, we don't want to leave it with the jury that she's so vain that she just didn't want to take something that she might get a little rash. Right? In any event. Now, have in mind, there's no blood test, there's no enzyme test for metabolite test, there's no thyroid test, but we still have the pill factory through Dr. Tufts and then into Dr. Gelada for that period of time. You're telling this jury that that is, in your opinion, reasonable little drug doses that she was prescribed? Is that what you're telling this jury, sir?
That it was reasonable to prescribe?
Yeah, the drugs, one right after the other, and then stopping the SSRI, not weaning off, stopping it flat out. Is that reasonable?
Objection. Sustained, just as to form.
Is it reasonable, sir, in your opinion, to tell someone who's on an SSRI, such as Zoloft or Prozac, just stop it and we'll put you on something else, or should you wean it off?
In the case of the Zoloft and the severe insomnia, in my view, it was reasonable to stop it.
And then prescribe new drugs?
Well, insomnia was a significant problem, so as I recall, Ativan and Benadryl were prescribed to assist her with those symptoms.
Now, if somebody, is nervous because they have an exam coming up, or they just can't sleep because maybe they're worried about their job, there's a big difference between that and serious insomnia. Is that true?
Yes.
And Lindsay was suffering very serious insomnia, according to the medical records and her statements to her providers, right?
That's right.
And in fact, when Tufts increased the SSRI 25 to 50, she went 48 hours straight without being able to sleep, right?
That's in the record, yes.
And she went pretty much immediately to Tufts and complained about that and said, I can't sleep. It's 48 hours. I just can't sleep, right?
Yes, I think that was around the 21st of October.
And in your experience with dealing with terrorism and terrorist threats and things like that, would you agree with me that sleep deprivation is used as a torture?
It can be, yes.
And in fact, the side effects, if you will, of a person who's suffering from serious insomnia can actually lead to psychosis, can it not?
Yes, it's possible.
You're aware that while she's living in her house with her husband, Pat, and their 3 kids, that by all accounts, she was a happy mother, wife, friend, daughter, all of the above, right?
No.
So as the summer progressed, is it your understanding from Dr. Saathoff's investigation in this case that Lindsay Clancy and her husband Pat and their kids during the summer of 22 were not living their best life, enjoying life?
The summer was very good from Callan's birth really through much of August. Through the time that Patrick Clancy was at home, that first 12 weeks was really quite good.
And then it went sideways, right? She started having some concern about anxiety, right?
She did.
That brought her to Dr. Tuff's office. Brought her to talk to Dr. Tuff's on the telemedicine, right?
Correct.
And then she started getting her prescriptions, such as the SSRI at 25, SSRI increased to 50, 48 hours without sleep, went back to Dr. Tuff's, more medications prescribed, right?
Yes.
Was she in rough shape in October of 2022 after dealing with Tuff's for about 3 weeks?
She was certainly having difficulty, although the Benadryl and the Ativan were very helpful for sleep.
Okay. I'm just going to grab this item here. I'm just going to kind of hold it. In your investigation, and look, you did look at the text messages and all the stuff that was on Lindsay's phone. Right?
Yes.
Her life was pretty much turned inside out, right? I mean, government got access to every text message she sent, right?
Yes.
Every email that she sent, right?
Yes.
Every memo that she wrote on her phone or on her computer or whatever, right?
Yes.
Every journal entry that she ever wrote during this period of time, we have it all, don't we?
Yes.
And in October 20th, sir, did you see this text where she texted her mother and said, "Mom, will you please come up and stay with me a bit? I'm really sick. Something's wrong. I had horrible insomnia all night. I just don't know how I'm going to get through the day. I started to take medicine the doctor prescribed for anxiety, and I think it's made things worse. It's just really scary. And I don't..." Continue to see Tufts, right?
Yes.
Gelada, right?
Nurse practitioner Paul and then Gelada. Yes.
Okay. Now, in your investigation of the medical records, would you agree with me that Lindsay was not running around from doctor to doctor to try to physician shop to try to get drugs so that she could get high or use the drugs? That's not what she was doing, was it?
Ms. Clancy expressed concerns that she was not following a plan and that it would have been better for her had she tried to stick with a plan.
Is that one sentence in all of the medical records where it makes reference to the fact that she said something like, I should have stuck with the plan? Is that what you're referring to?
Yes.
Okay. My question, sir, was Dr. Tufts, Dr. Paul, Dr. Gelada.
Nurse practitioner Paul and Gelada.
I apologize again. That's
all right.
My bad. Nurse practitioner Gelada. Up to that point, bringing us into November, these people and other emergency room visits that she had, she was not going out looking to score drugs off of drug prescriptions. Is that fair?
Correct.
And she, in fact, looked up Tufts, but she didn't even know who Tufts was. She went online and Googled postpartum depression and found an expert. Isn't that right?
That's my understanding.
But she was only practicing for like a month or two. Was she, in your opinion, to a reasonable degree, a psychiatric certainty, an expert?
Objection.
Overruled.
depends on the amount of training that she received, not just as a physician and a resident, but also in the area of women's health.
So the young lady goes online, Googles, trying to get help, goes to see the expert, Dr. Tufts, ultimately deals with nurse practitioner Gelada and counselor that worked in that medical field business, Letitia Dukes, I believe is her name.
Right.
And then she had the need to go to an emergency room and went to Mass General Hospital, right?
That's right.
And she was with her husband, Pat, right?
Correct.
And she had been complaining about lack of sleep, insomnia, right?
Yes, as I understand.
She had been complaining about inability to emote, feeling hollow, not myself, right?
Correct.
And a number of other complaints that were brought to the fore. And the hospital made a recommendation that she go to McLean Hospital, which is a locked ward mental institution in Massachusetts, and she chose not to do that, correct?
That's right.
So then what she did is went back to her home and immediately hooked up again, if you will, with Tufts, right?
That's right.
In December, one of the people at the South Shore perinatal unit advised her to go to a hospital that specializes in postpartum women. That would be Women and Infants Hospital in Rhode Island, right?
That's right.
And she went there like the next day, right after they called, right?
Yes, I think they fit her in pretty quickly. Was it maybe the 20th of December?
And her husband dropped her off for that day program, right?
That's right.
And she participated with the coloring, with the conferences, or with the discussions, and evaluations with the doctor, right?
Yes.
For about 8 hours. It was about an 8-hour day, right?
Something like that.
And on that day, in December 20th, she was turned away, basically, right?
I don't know that I would term it turned away.
Did they help her?
By Dr. Diaz's notes, but
Did they help her?
pardon me?
Did they help her?
They felt that another program might be more appropriate, either inpatient or partial hospitalization or outpatient, just based upon her concerns about medication.
And her concerns about the symptomology of postpartum depression, right? That's why she was there.
She was having depressive symptoms, yes.
Right, and that's in addition to, everybody wants to say GAD, 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 general anxiety, depression. This woman was there for treatment of postpartum depression, right?
She was there for treatment of depression. I was under the impression that most of the women who were in that program were much closer to had given birth to their children. And so in that respect, it was not the group that they served were much closer to that postpartum period, as I understand.
You're not going to say to this jury that because Lindsay was outside of the, let's say, 4-month cutoff, that she was not a good candidate for postpartum depression treatment? Is that what you told us, Jay?
No.
Oh, okay. I'm sorry. I thought you said because of the time frame from giving birth to the time that she went to see them.
I was just speaking about my understanding from the note from Women and Infants in terms of their decision-making.
Okay. And Women and Infants basically discharged her after about 8 hours, right?
Yes.
And her husband was up skiing, and then she contacted him, and he had to come down and pick her up and bring her home, right?
That's right.
And the reason that she was discharged from Infants Hospital in Rhode Island included a statement, RO, rule out issues regarding prescription medications, correct?
Yes, that's my recollection.
And she indicated that she was going to go right back to TOPS, right?
Yes.
And she did, didn't she?
Yes, as I understand.
And would you agree, sir, that every time a doctor said to Lindsay to do something, whether it was to make an appointment somewhere, whether it was to take another drug, any advice, that she was on it immediately? Is that fair?
She attended her appointments, yes.
Well, not just that, she attended them right away. She was told, for example, at McLean, you read those records, that she should hook up with her provider, and she did the very next day, right?
Yes.
Okay. So she wasn't avoiding seeing healthcare professionals, was she?
No.
And she was continuing to express concern about her state of mind. She felt that her mind, her brain was being damaged. Isn't that right?
That's right.
Those are in the records, right?
Correct.
And she felt that her brain being damaged was permanent and she was never going to get better, right?
Yes.
She was complaining not just to her physicians, but she was complaining to people in her community that she was having intrusive thoughts, dark thoughts, suicidal thoughts, and homicidal ideation. She said that, correct?
The homicidal ideation, as I understand, was just voiced to her husband and her mother.
Just voiced? Is that what you just said? Just voiced? Is that like talking about the Red Sox? She's talking about homicidal ideation of her children.
Sustained. Next question.
I asked you about her complaints of intrusive thoughts, complaining to doctors, complaining to friends, complaining to neighbors, family about dark, intrusive thoughts of suicide and homicidal ideation. Didn't she?
I just don't recall that she complained of homicidal ideation to
Okay, so-
healthcare providers.
Did you finish answering?
I think, Doc, you finished? Did you finish the answer? Doctor, did you finish that last answer?
Sure.
Okay. All right. Next question.
So we'll put homicidal ideation aside for a minute. Would you agree that for that period of time, short as it may have been in her life, November into December, that she was reaching out to people that would listen to her for help?
Yes.
Would you agree, sir, that she would tell, for example, neighbors or friends with the Learning Sprouts School, her family, her doctors, that she was having these dark, intrusive thoughts of suicide? Yes or no?
Did you ask whether or not she was telling her children's teachers at Learning Sprouts?
Anyone that she would come in contact with at Learning Sprouts, whether it's another mother, whether it's a friend, whether it's a teacher, whether it's an administrator, whether it's somebody that just watches the kids in the playground, did she tell anyone that she had dark, intrusive thoughts to your investigation?
Those people that you named, I wasn't aware that she informed them about that.
When someone says, with her history up to this point in December, that they're having dark, intrusive thoughts to a professional, in your opinion, sir, to a reasonable degree of medical certainty, does it make sense that the professional should ask the person whether or not these are voices that they're hearing in their head, or whether or not they are just thoughts that they're having?
certainly exploring that is important.
And would you agree with me, sir, that when you have a young woman that, again, by all accounts, done nothing wrong in her life, exemplary citizen, has these issues and sees the doctors that, to a reasonable degree of medical certainty, a physician should do a little bit more than asking, do you have a plan? I mean, is that accepted practice, just to say, do you have a plan? And if they say no, you're okay.
I wasn't aware that that was the only question.
Okay. She was also told that counsel had asked you yesterday about other recommendations that were given to her by women and infants, and that you said that she did not follow through on that, but she did see Dr. Tufts pretty much the next day, right?
That's my understanding, yes.
Okay, and she said that she was going to go see Dr. Tufts the next day, right?
Yes.
And just to mention, before I forget it, the Lamictal, I think you mentioned to the jury that she had a prescription for Lamictal that she was able to fill, right?
Correct.
But she didn't take it, right?
That's right.
And then Tufts told her that she was going to, she meaning Tufts, was going to give her a script for Lamictal, and she said, no, I already have one, right?
It was Nurse Gelada.
Okay, sorry.
She had gotten the prescription and filled it from Dr. Tufts. And Nurse Gelada, when asked about the Lamictal, was very favorable about it and said, yes, that's great. That would be great.
Sir, I know. You want to tell me that it's a wonderful drug. Did she tell nurse practitioner Gelada, I already have a script, I don't need it?
Yes.
Among other things, when people are in trouble and they're having dark suicidal thoughts, whether or not it's voices in their head, whether or not it's thoughts that they can't go on anymore, they can't live life, they have to kill themselves, many times they're told to call suicide hotlines, right?
Yes, Aspire.
Aspire. What is Aspire?
I don't know what it stands for, but it is a hotline that Ms. Clancy called twice because of her suicidal ideation.
When did she call Aspire saying that she had thoughts of killing herself?
I can't recall specifically.
But she did call them not once but twice and told them. So she complained and told them that she was going to kill herself, right? Twice. Right?
She spoke to them about suicidality.
So here's a young woman with all of what she's been through who now is to the verge of killing herself and reaches out to people that her health care providers told her to call for help, said that she was going to kill herself, and what did Aspire do?
As I understand, they redirected her to her provider. They did not make a decision to hospitalize or to recommend hospitalization.
They didn't make a decision to do anything.
Objection.
Yeah, so you can form that as a question, please.
Did you read the records dealing with Aspire? Did they do anything other than tell her, no, you're not someone that we can help?
I know that they were not responsive to her suicidality because she did not indicate that she had a plan.
And did you read a transcript or listen to a tape, or how do you know that?
I recall it someplace in the documents, it being referred to, but I can't tell you exactly where.
So this, sir, obviously is a murder trial, and you are a witness for the government, and you've indicated that you've read the records. You just told this jury that in the conversation that she had with the people from Aspire that she expressed suicidal ideation and was asked if she had a plan. Where are you getting that from?
I can't tell you exactly within the records.
How about the second time she called Aspire? Why would she call Aspire again if they wouldn't help her the first time? In your opinion as a psychiatrist? Looking for help?
Continuing to seek help.
And yet again, she didn't get any, did she?
That's my understanding.
To a reasonable degree of psychiatric certainty with treating the patients to the extent that you've told this jury that you have, what kind of a devastating effect would that have on a person who's ready to kill themselves that's called Aspire hotline twice and has been turned away?
Objection.
Overruled.
It could have a very serious effect.
And after being discharged from Women and Infants Hospital and reaching out to Aspire, you'd agree with me that one of the concerns that the doctor at Women's Hospital in Rhode Island had is the medication that she had been prescribed by top-end nurse practitioner Gelada, right?
Correct.
And that's one of the reasons that they could not treat her. It wasn't just that, no, we don't think that you're postpartum depressed. We just think that there's a complicated overlay involving the medications that you've been prescribed, right?
Yes.
And these medications obviously included selective serotonin reuptake inhibitors, right?
Yes. Prozac and Zoloft.
Right. And one of the things that a doctor would be concerned about, especially with a woman who's had a baby and has stopped breastfeeding the baby, is the effect that that may have on the woman, physically, mentally, emotionally, when they stop breastfeeding a baby, right?
Yes.
And you've heard of gamma-aminobutyric acid, otherwise known as GABA, right?
Yes.
And can you tell us, please, what that is, sir?
I'm sorry.
Can you tell us, please, what that is, sir? What is GABA?
I believe that you're referring to Lyrica.
No, I'm asking about the actual acid in the person's system, their blood, that is gamma-aminobutyric acid. It's got nothing to do with lamictal. It's got nothing to do with Seroquel. It's got nothing to do with the drug industry. This is in the body. When a woman stops lactating, a woman stops breastfeeding.
Yes.
There is a physical effect on the person, the body, right?
Yes.
What is that effect?
It depends on the individual. There's variable responses postpartum, and as I understand, she stopped breastfeeding around by October 21st or so, when the Ativan was started.
Would you agree with me, sir, that the GABA, make it easier to type, is basically affects, its primary effect is on the neurotransmitters in the brain, right?
Yes.
Okay. That sounds pretty complicated. Neurotransmitters, I mean, is that like where you have a spark plug on a motorcycle and you can actually gap it and get it to kick over? It's a neurotransmitter in the brain? That sounds like it.
Well, yeah, it's more complicated than that.
I figured.
Obviously.
But nevertheless, it's still basically, you're talking about the actual organic matter of the brain, right?
Yes.
And would you agree, sir, that when a woman is pregnant, that there are progesterone hormone surges during that pregnancy?
Yes, there are hormonal changes.
Their hormone doesn't just change, it can actually surge, and it can be quite impactful to the person, right?
Yes.
And would you agree with me, sir, that one of the metabolites of progesterone, which has been unleashed when a woman is pregnant, with the progesterone hormone surging through their body, that you have a metabolite that actually enhances or increases the GABA activity of the neurons in the brain, right?
It can, yes.
And what is that metabolite, sir, that increases that activity in the very organ of the brain?
I can't tell you.
Is it a allopregnanolone? If you know.
No.
No, it's not, or no, you don't know?
I don't know.
Immediately after a woman has a baby, would you agree, sir, that the progesterone that we just talked about and the allopregnanolone that you don't know about drops precipitously according to the medical treatises, right?
Objection.
If he knows, he can answer that.
Yes.
And what does that mean, sir? Tell me, when it says that the progesterone and the allopregnanolone in the body drops precipitously. What does that mean, precipitously?
That means rapidly.
And a sudden drop, sir, you would agree has a significant potential of causing serious GABA dysfunction, right?
That certainly would be possible.
Do you know that, or are you just agreeing with me?
I'm agreeing with you.
Okay. Do you want me to keep going?
Want to take a short break?
I don't care. I'm just saying that.
Yeah, why don't we take the morning recess at this point? All right.
Court, all rise, please. Jurors, kindly close your notebooks. Please on the chairs. This way, please.
And its effect on the brain synapses is referred to as breaks, B-R-E-A-K-S. You've heard of that term, right?
No.
You aware, sir, that when you get to the point where you have that precipitous drop in the progesterone and the allopregnanolone dropping precipitously, that in fact it constitutes and causes significant neurotransmitter malfunction, referred to as broken brakes?
I'm not familiar with that term.
Can you tell me what a neurotransmitter in the brain is?
You're asking what is a neurotransmitter?
Sure. I don't know.
Neurotransmitters function in the brain and have responsibility for not only aspects of mood, but also psychosis. Dopamine is a neurotransmitter that is significant in terms of psychosis when it's too high. We need it, and the neurotransmitters function in a number of different ways, number of different pathways. when we think about psychiatry, we really think about the mesolimbic pathway and not just dopamine, but also serotonin, norepinephrine. And so depending on the disorder, there are different medications that can be helpful in treating those disorders. So really, from the standpoint of psychiatric illness and brain dysfunction, medication can be very helpful in regulating the neurotransmitters and difficulties.
Have you heard of the broken brakes hypothesis as it relates to the impact of the precipitous drop of progesterone in the enhancement of the GABA activity? Have you heard of that concept?
No.
Would you agree, sir, that when a woman is in that position of the precipitous drop of the progesterone after ceasing the breastfeeding activity, the enhancement with the GABA...
You mean prolactin?
Prolactin. The enhancement of the GABA activity, that that would be a dysfunction in the brain, right?
Certainly, mood symptoms can be significant.
Would you agree, sir, that the dysfunction in the brain caused by those two items is consistent with intrusive and hard to control thoughts and highly impulsive, uncontrollable behavior? Would you agree with that?
I would say that's possible.
And that would relate to the capacity of a person to conform their conduct. If, in fact, because of the GABA and the progesterone and all that we just talked about, the intrusive, hard-to-control thoughts and highly impulsive, uncontrollable behavior would address itself to the issue of capacity to conform one's conduct, right?
No. I mean, it depends on the timing. If you're talking
Is the answer no?
at 8 months,
Yeah, hold on. You gotta let doctor finish. Did you finish that answer?
yes.
Okay. All right, go ahead. Next question.
So, did I hear you say that Patrick is the source, the third-party collateral source of Lindsay saying, I tried to kill myself? Is that what you said? Let me rephrase it for you. I mean, did you tell the jury about an hour ago or so that...
When her husband found her on the ground?
Yeah,
Yes, or something to that effect.
something to that effect, okay. And did you listen to the 911 tape when Patrick was actually speaking with Lindsay as she's laying prostrate in the snow on the ground with the broken neck and the slashes and the slits?
Yes, I did.
Did you hear her response to Patrick's comment, what did you do?
No.
Did you hear her respond to anything other than what would be described as guttural grunts?
Not on that call.
So when this conversation occurred, and this is the conversation that you're talking about, where she said, I tried to kill myself, kids are in the basement, he then goes into the house, right?
Correct.
All right. So now we have the EMTs and people are helping her out. You've seen the medical records. You know what the injuries were. You know the damage to her throat. You know the damage to her thyroid, right?
Yes.
And is it your testimony to a reasonable degree of doctor certainty that a person with those injuries, with the prescription drugs that were crushed up, that she consumed, with a broken neck, would be able to have a conversation?
Based on the witness testimony from her husband, yes.
Okay. So let's put the witness testimony from Patrick aside for a minute. And you listened to the 911 call. Are you telling this jury that she had a conversation that you could discern what she was saying?
Not on the 911 call.
No. Would you agree that they were all grunts?
Yes, from what I heard.
So Patrick goes in the house, relates the fact that he found the children, and you told the jury that his office door was closed, is what he said. Is that right?
Yes.
Where did you get that from?
I believe Patrick told me that.
Is that in your report?
Yes.
And when he told you
It's-
that, when was that conversation that you had with Patrick?
When I interviewed Patrick Clancy.
Okay. So you read the grand jury minutes, right?
Yes.
You read the police report, right?
Yes.
You know that Patrick went up the stairs, and when he went up the stairs, the door was locked, right? Meaning the bedroom door, not the office door.
Correct.
And then he was able to open the door, right?
Yes. With
And
a
there
key.
was blood on the doorknob, right?
There was blood in the room on the
Describe the room
on the
blood.
floor.
Certainly, you already talked. We'll talk about that. But there's blood on the doorknob, right? Was there blood on the doorknob? If you know,
I don't recall.
do you recall there being blood drops in the area of the door itself, like where you have the threshold? But what appeared to be blood, because nobody tested it, we don't know what it is, but it appeared to be blood.
I don't recall the specific. I know that there was blood that was observed.
Okay. And you would agree that there was a lot of blood drops, drips on the mirror, drops on the floor, drops on the nightstand, right?
That's my recollection.
And you looked at the photographs in your investigation and looked at the testimony, third-party collaterals, as you testified yesterday, right?
Yes.
And you told the jurors that one of the things that was of interest to you is the fact that there was a glass or a wine mug or something that had crushed narcotics or I think you used the word antipsychotic drugs crushed up inside that cup. Do you remember that?
Yes.
Okay.
Wine tumbler.
Thank you. How do you know they were antipsychotic drugs?
I don't recall saying that they were antipsychotic drugs.
Oh, did you say they were drugs?
I thought I said medications.
Medications. All right, so drugs, medications, and they were crushed up?
There was evidence of powder on the tumbler that Patrick told me about, and I went back and looked more closely at the photographs and saw that.
Did you look more closely at the NMS laboratory or the state police crime laboratory or any testing that was done on the powder?
Yes.
And was there a report that said that indeed it was crushed up medication?
They wouldn't.
I mean, there is.
They didn't indicate whether or not they were pills or.
Did they ever? I'm not asking about pills or powder. Did they ever test the residue?
Not that I'm aware of.
So how do we know that that's even drugs or medications or whatever word you want to use?
It was Patrick Clancy's observation.
So basically, when you're testifying, sir, and you're waxing on about all of the facts of the case that you took into consideration prior to your opinion for the DA in this case, you're getting a lot of it from Patrick, is that right?
That aspect he brought up to me, yes.
Okay. So the crushing of the pills, was there a pill crusher found in the bedroom?
Not that I'm aware of.
Was there any residue found anywhere in the bedroom?
Not that I'm aware of.
So if someone's in a psychotic state and they're going to kill themselves and they're taking the pills, yesterday you said the fistful of pills, and then the DA said after painful questioning that they were crushed, and you agreed that they were crushed, wouldn't there be a residue?
A residue?
Yeah, you know what a residue is, right?
Yes.
Was there a residue on the table, on the nightstand, anywhere?
Not that I saw.
So there's no pill crusher, right?
Not that I saw.
There's no investigation by the police to determine what was in that powder, right?
Not that I'm aware of.
There's no indication that there's any residue on or in the actual nightstand next to the bed, right?
Not that I'm aware of.
Does it seem appropriate, sir, that a person would be in a psychotic state after slashing their wrist and slicing their throat and ready to propel themselves out a window would neatly put the bottles into the drawer of the nightstand? Or would they just scatter them around the bedroom floor, not caring?
I'm not aware of the exact sequence of the events in terms
Well, if I tell you, sir, that a couple of days after this incident, I went into the home with Patrick, and I was able to locate in the bedroom, right next to the bed, with all the blood all over the place, this drawer, and inside this drawer would be a lot of medication bottles. Does that refresh your memory on your investigation as to what happened to the bottles? They're all empty.
Yes.
Okay, so how'd they get in the drawer?
How did they get in the drawer? I don't know.
You can fingerprint them, right? Did anybody do any testing at all in this investigation? If you know, you told the jury yesterday you read all the stuff, grand jury minutes, police reports, lots of witnesses.
Yeah, I did not read that.
Is it your understanding, sir, that a person can be in a state of psychosis and I guess misremember something?
Yes,
Or have a false memory?
it's possible.
Did Lindsay tell you that she slashed the screen with the big turkey knife?
I'm sorry, can you repeat that?
Yeah, did she tell you that she slashed the screen with the knife before she went out the window?
Yes, that's what she told me.
But the screen wasn't slashed, was it? Do you think she was malingering and lying to you at that point, sir, when she told you that?
No.
Because one of the things you told this jury is that what stood out to you is, I think you made reference to the fact that Lindsay betrayed her family by misleading her family. Remember saying that to this jury yesterday, sir?
Portrayed?
Betrayed is what you said.
No, I said portrayed.
So Lindsay portrayed and misled her family, is what you said to the jury?
Yes.
How'd she mislead her family?
Well, in text messages, for example, in the days prior to the event, her parents had visited over that weekend, and the communications that she was providing did not give a sense of her state of mind regarding suicidality.
You kidding me? They stayed up in their house to help them.
Sustained. Next.
They stayed at the house, didn't they?
Yes.
Why did they stay at the house?
I'm sorry.
Why did they stay at the house?
They were visiting.
They were staying at the house. They weren't just visiting.
Objection.
Overall.
Sleep over?
As I understand.
Okay, as you understand. How long did they stay at the house and sleep over?
I think they came up for that weekend. They weren't there constantly.
No,
They came back and forth.
back and forth. Well, they stayed about 4 days, 3 nights. They stayed continuously and stayed at the Clancy home. You knew that from your investigation, right?
Yes, that's my
yes?
recollection.
The answer is yes, right?
Yes.
Okay. So they're staying at the same time you're telling this jury that she's sending text messages basically saying, I'm okay, I guess. Is that right?
Following their departure, there were the photographs that Lindsay Clancy sent to her mother.
She didn't send her mother photographs showing that she was smiling or happy with her family, did she?
I think there was a photograph of her and the children by the snowman.
No. Is that a bad thing to do that and send a picture of you with your kids making a snowman to your parents?
No.
Is that something, in your opinion, Dr. Saathoff's opinion for the district attorney, that a person who is involved with postpartum psychosis, postpartum depression, wouldn't take a picture of the snowman and their kids, send it to their mother?
Given the prior text that you showed to her mother in terms of being in terrible distress, that she was able to do that, that was not what happened when she sent the picture with her children, the snowman, and so did not raise concerns from the mother, as I understand.
Did you talk to the mother?
Pardon me?
Did you talk to the mother?
No, I tried to.
Did you review police reports or statements? You tried to? How'd you do that? Would you do? Call her up and say, I want to talk to you?
No.
Did the district attorney call him up?
I asked Ms. Clancy who would be good for me to speak with, and she said her husband and her family.
Okay. So based on that, what did you do?
I contacted the district attorney, and I...
Which one? Which one of these two?
Ms. Sprague.
Ms. Sprague. Okay. You spoke to Jen Sprague, and what did you say to her?
Sprague.
What is it?
Attorney Sprague.
You spoke to Jen Sprague, and what did she tell you?
Attorney Sprague.
She told me that she would reach out and attempt to see if I could interview Mr. Clancy and Ms. Clancy's family.
Okay. So did you do that? Did you reach out to her mother?
Did I reach out?
Yeah.
No.
Okay. Did someone tell you that she wouldn't speak to you?
Yes.
And when was this, sir? About 2 months ago?
It would have been probably June 5th.
This is August, right?
Pardon
This
me.
is August. We're in August right now, right?
Yes.
You called to speak to the mother in June, right? Yes? Come on.
Yes.
Okay. And when you called the mother, did she say,
I did not call the mother.
Okay, so the
I did
answer
not
is you
call
did
the
not
mother.
call the mother. Who told you that you couldn't talk to the mother?
Ms. Sprague.
Attorney Sprague, please.
Right. Attorney Sprague.
Now, when Attorney Sprague called you and said you cannot talk to the mother, did it ever occur to you to reach out to me? You're being objective and all.
No.
Did you know, sir, that Lindsay had signed repeatedly every and any HIPAA form that was needed by the DA or other cops to get access to every single medical record that she had? Probably going back to when she was in grammar school. Did you know that?
I know she's been open to it, and she told me that she would like for me to speak with them.
Right. And she's been open to pretty much anything and everything that was asked of her as far as signing documents, getting medical records, doing interviews, videotaping, making appointments to talk to guys like Mac and Helbrun and you in Tewksbury Hospital, right?
I'm sorry, can you repeat the question?
All of your investigation, sir, led up to the fact that you were going to meet with Lindsay 2 months ago, 2 months prior to our beginning this 5-week triple murder trial. Is that fair?
That's true.
And you told this jury that you wanted to establish a rapport with this kid?
Yes.
Do you think for 1 minute, when you're trying to put her in jail for her life, that she
Objection.
wants to talk to you and have a rapport?
Sustained. Next question.
Did you establish a rapport?
I believe so.
She was cooperative.
Yes.
She was polite.
Yes.
She was pleasant.
Yes. And I asked her at the end if there was any question that I had asked that made her feel uncomfortable, and she responded in a positive way.
Okay. One of the things that you told the jury is that you felt that she was malingering, or basically lying. I guess you were telling the jury, in your opinion, that she was making stuff up to make herself look like she's crazy when she killed the children. Is that what you told the jury?
I didn't use those words.
No, you're a little more finesse than I was. But nevertheless, sir, you're talking about malingering, right?
Yes, the statements about the auditory
Answer is
hallucination.
yes. Excuse me.
Yes.
Answer is yes. You were talking about malingering is my question. Yes or no, right? That's all.
Yes.
Okay. And when you're talking about malingering, sir, basically that would be when a person finds it in their interest to basically exaggerate or lie to an investigating psychiatrist, right?
Correct.
And that would be because it's in their interest, like I want to pretend that I'm crazy so a jury thinks I'm crazy and I don't have to pay for a crime. That would be in a criminal sense, right?
Yes.
Workman's comp cases, you know, a guy gets hurt in the truck and then they end up having interviews by guys like you to make sure to see if, in fact, they're legitimately hurt for a workman's comp claim, right?
Yes.
Or a civil case, like an auto accident, right?
Yes.
And there are tests that can be administered to people to see, from a psychiatrist standpoint, whether or not there is objective indicia of the fact that the person is indeed malingering.
Yes.
And what are those tests?
Well, I'm not a neuropsychologist, but there's a test called the SIRS, also the TOMS test of memory. So there are certain tests that can be given by neuropsychologists to assess malingering about certain aspects, certain issues.
You've also heard, I imagine, of the MMPI, which is the Minnesota Multiphasic Personality Inventory Test, right?
Yes.
And that's one that has different scales that you can examine to determine if somebody is lying or malingering or exaggerating or anything like that, right?
Correct.
And you know that Dr. Helbrun administered that very test to Lindsay about, I don't know, 2 months before you got there, right?
Yes.
Which would be about 4 months from now, where we stand now, right?
Something like that.
And would you agree, sir, that even though it would have been perhaps better to actually meet with Lindsay within the first 6 months after the incident, or a year even, or maybe even 2 years, but nevertheless, it still has reliability and validity, does it not, when it's administered to her?
The MMPI does, yes.
Okay. And you know, sir, that she, in fact, had no impact on the scales at all, with the exception of likelihood of suicide.
Yes, that's my understanding.
Indicating that, as far as that test that was administered to her by Dr. Helbrun, did not have any evidence at all. This kid was lying, exaggerating, suppressing anything. She was being truthful, right?
Objection.
Overruled.
About the questions that were on the MMPI, yes.
And those questions, sir, pertain to personality traits, they pertain to her recollection, they pertain to all of the investigation that Helbrun was conducting, right?
No.
Okay. So, when the tests were administered and the results were provided, would you agree with me, yes or no, that specifically the test indicated that she was not malingering?
Yes.
Okay.
Correct.
You mentioned one of the other things that you were concerned. Oh, by the way, would you agree with me that Dr. Philip Resnick, as you indicated, is like a world-renowned person on filicide, or the killing of your children? He's also a person that is in the forefront pretty much worldwide on malingering, right?
Yes, he has written about that.
He's done more than write about it. He's basically given hundreds of lectures and many, many, many learned treatises all about people that lie to psychiatrists to try to get away with something, right? Right?
Yes.
Okay. And you know, sir, that Dr. Resnick examined Lindsay, and one of the first things that he did was determine whether or not, in his opinion, she was malingering, lying, suppressing, exaggerating, or doing anything like that, right?
Yes.
In his opinion, sir, when you read his report after all the testing of his examination, is that she was not lying to him at all. Isn't that right?
Yes.
One of the things that you referenced, sir, was you felt that Lindsay was lying about standing at the refrigerator and making chicken McNuggets or whatever and carrots or peas or something. And you felt that that wasn't right because the child had already had a bowl and was eating, I think you told the jury, chicken nuggets and vegetables or something like that, right?
Green beans.
Green beans. Have you looked at the photograph, sir, that's in evidence in this case about that bowl?
Quite some time ago.
Does that show any residue of chicken nuggets or green beans in the bowl?
Not that I recall.
No, it shows like sliced up residue of a cucumber, possibly a carrot, like vegetables, right?
Not that I recall.
So there are 3 kids, one of which is an infant who obviously pretty recently got finished breastfeeding, is on the bottle, so he's not going to eat chicken McNuggets, right?
Right.
So we have 2 young children that have to be fed, correct?
Yes.
You have 2 young children that Lindsay indicated that she was at the refrigerator getting the chicken and the vegetables so that she could feed the kids, correct?
Yes.
Told you that she would not give the kids chicken McNuggets and vegetables in a bowl, that she would have a plate, right?
Not necessarily.
So when she was at the refrigerator, sir, it's your understanding that she was not being truthful? Telling you that? Is that what you're telling the jury?
I think what I said was very inconsistent with what she had told Dr. Spinelli.
So when she's at the refrigerator and telling you, your interview, I know you imported Dr. Spinelli's report, you imported Dr. Resnick's report, you imported Dr. Zeisel's report. When you were talking to Lindsay, did she tell you she was getting food for the kids out of the fridge?
That's my recollection.
Now, with all of the understanding in your testimony, sir, about the voices, correct me if I'm wrong, you're telling this jury and Dr. Saathoff's opinion, based on your experience and all of your writings and everything, that when one hears voices, they would be internal or external? To be legit.
They can be either.
Really? I'm sorry, I thought you said that they had to be a particular type, like not internal. If they're internal, they're probably lying. But that's not true, I'm wrong?
The voice that Ms. Clancy told me about during the time of this event, she said was external.
Okay. And is that consistent with your understanding, sir, of the research on auditory hallucinations?
Well, some auditory hallucinations can be internal.
So,
for people who are psychotic.
and you were aware, sir, that Philip Resnick, Dr. Resnick, did publish the article in the International Journal of Law and Psychiatry in 2014 in conjunction with Simon McCarthy-Jones. You're aware of that?
Yes.
Treatise, yes. And would you agree with me, sir, that in fact, just if some doctors might feel that hallucinations auditory must originate from the exterior as opposed to interior? Would you agree, sir, that in this article, claim number 1, doctors may say, voices are typically heard as coming from inside the head, with the corollary that voices heard as coming from outside the head are atypical? Would you agree with that?
That was not my recollection of the research that
Okay.
I understood that it was a minority of,
No, excuse me. It doesn't matter what you...
Oh, hold on. Good. Next question.
I'm going to approach you with the article. We've already established who authored it, read it, all that. Okay?
It was quite some time ago.
Sure. Let me put your papers over here just so I don't knock them over. So, if we can share that?
Do you want me to say it?
No, I want you to share it. Put it right here so I can look at it. Okay, all right. Would you agree, sir, that it says voices are typically heard, this is a claim number one, in other words, doctors feel voices are typically heard as coming from inside the head, with the corollary that voices heard as coming from outside the head are atypical. Did I read that right?
Yes.
Okay. And what does atypical mean?
Atypical means unusual.
Right. And this article is saying that there are psychiatrists that feel that voices heard outside of the head, auditory hallucinations, are indeed not legitimate. Is that fair?
That was the old original way of thinking. That was the way it was taught at one time. That they had to be external for someone to actually be experiencing psychosis.
Okay, so we agree then, as Dr. Resnick indicates, that the research evidence does not support the claim that internal located voices are emblematic of genuine AVH,
Auditory verbal hallucinations.
and externally located voices are atypical. We cite a particular word, correct?
Yes.
For example, he then says, the largest study on this question, Kathy Jones, was in 2012. That's what you're referring to as the old research, right? Oh, one other thing, you were in med school and you taught me that too. That would have
That yeah, I was speaking about very old.
been, okay. Basically found that of 199 psychiatric patients, 81% who have been diagnosed with schizophrenia, 38% heard both voices coming from inside and outside their head. Did I read that right?
You did?
All right. So when Lindsay indicated to you that she indeed heard a loud auditory hallucination voice, deep male, commanding her to do what she told you, that was external, correct?
yes,
And you don't have any issues with that. In other words, that is very likely could be legitimate.
yes.
Okay. Now, if you take a young woman who, as the evidence has shown, is suffering with her medical condition or psychiatric condition and seeing doctors and being prescribed medications and reaching out to people for help and suicide hotlines and people down in Rhode Island and McLean Locked Wards Institute. If I hold an opening statement, sir, would you agree that in her efforts to maintain control, she, meaning Lindsay, withheld...
Form of the question?
Yeah, if we could approach.
Sure.
Would you agree, sir, based on your investigation, police reports, statements of witnesses, grand jury, photographs, videos, interviews of Lindsay, review of witness statements, all of that you told us yesterday that you reviewed, that in fact on January 24th of 2023, Lindsay made a calculated decision. She was a woman who no longer liked the life she thought she wanted. It was getting harder and harder for her to control, and when she saw the opportunity to escape, she made the selfish choice to take it, and to take Cora, Dawson, and Callan first, before attempting to take her own life. Continuing on, sir, she chose to manipulate her providers, seek out a quick and easy fix when she was feeling depressed and anxious, and when she didn't get what she expected, she chose the alternate route. She would seek a different doctor. She would change medications after days. She disengaged from treatment that she didn't like the plan, and after only 4 months in treatment, she made a choice, a deliberate and intentional decision that she did not want to try anymore. And because no one could take care of her kids the way she wanted them to, she had to take them with her too. Would you agree that the evidence, in your opinion, supports that contention, sir?
Well, there's a lot in that.
Yeah, it is. Do you agree that it would support your contention, sir, or it would not?
I think that statement that you read really minimizes what she was going through.
Okay. All right, thank you.